Sports injuries are very common, and pain after an injury is also very common and one of the commonest presentations in our clinic. I think one of the commonest causes of injuries or forms of injuries is ankle ligament injuries. So here the patient usually rolls over their ankle, damaging ligaments on the outer aspect of the ankle. They could sometimes damage other ligaments, but this can in turn lead to ankle instability and can lead to longer term problems. Another cause of pain can be fractures. So again, during injuries, whether patients have been tackled or whether they go over their ankle, they can cause fractures. The commonest fractures are fractures around the ankle itself, but sometimes other forms of fractures can present as well, like fractures of the metatarsals, like fractures of the calcaneum or the heel bone. Any bone in the foot can fracture during sports. Another form of presentation are injuries that result into damage to the joint surface. So we call these osteochondral lesions. So these are lesions that involve osteo means bone, chondral means cartilage. So it's a combined injury to the cartilage and the underlying bone. And this usually have a specific presenting with a deep, dull ache that keep happening whenever patients engage in sports or physical activities. The next, or another form of injury that is very, very common as well in the foot and ankle are injuries to the Achilles tendon. So Achilles tendon ruptures, partial injuries, complete injuries, muscle tears, and so on. These are very common injuries that can cause presentations in the foot and ankle clinic. So this is a very important question. It's actually a very good question. The key thing to differentiate here is the severity and the significance of the pain that results. So if a trivial ankle sprain happens, pain should be moderate. Patients should be still able to put weight and to walk. Whereas if you experience severe pain, then it should always highlight the possibility of a more significant injury. We should also relate this to the nature of the injury. So usually an injury that results from a simple trip and fall is different from a very heavy tackle during a football match where somebody, steps on a foot and causes a significant amount of deviation of the foot, for example. These can result in much more severe injuries. The ability to put weight after the injury. So if somebody is able to walk, then that's a good indication. If somebody finds it very difficult to walk, then that's an indication that is something more severe that has happened. Also, the more severe the injury, the more swelling and bruising the patient will present with. So again, a simple fall shouldn't result in, a black and blue pattern of bruising all over the foot. This indicates that something more serious has happened. And finally, it is the recovery and the improvement. So if this is a simple sprain, you would expect to be better really within a couple of days, maximum a week. But if you're having problems ongoing for more than a week and ongoing pain, ongoing swelling, ongoing insecurity on the ankle, then there is definitely something more going on. So immediately after an injury, the treatment is the acronym RICE, the rest, ice or, cold compressions, compression and elevation. So the key thing is obviously to try and rest that part and to keep it elevated because the elevation reduces the swelling quite significantly. The cold compresses also, or the icing of the ankle, prevents a big hematoma from forming, and applying some compression like a crib bandage or so again reduces the amount of swelling that happens initially. But I would say that any injury that is either severe enough or the pain that happens subsequently is quite significant, then you should really be attending accident and emergency or attending minor injuries. Here, usually patients get examined, and more importantly, they get usually assessed by an X-ray to rule out fractures, because this is the main thing. And then one key part of the recovery here is the initial immobilization. So, and this is a problem because a lot of patients attend A&E and they just get sent home with, a tube grip or, a very simple form of, well, it's not broken. You can get on with it. And that's quite bad. Ideally, you should really have some form of immobilization in a form of a boot, particularly if the injury is quite significant. Because what tends to happen here is that if somebody is in a lot of pain, they can't put weight, and therefore they start hobbling around. The next thing that happens when they're hobbling is that the calf muscles will start to become very tight over a period of time. So even if they have a sprain, what happens is they need a lot of input from physiotherapy afterwards to recover properly. Whereas if they go through even a short period of immobilization, it prevents the tightness of the calf muscles and it allows the recovery to be much faster. So in short, RICE, definitely attend A&E and ask for x-rays if the pain is significant enough. And finally, a period of immobilization in a boot. This period can be short depending or long depending on how severe the injury is. So this is again another very important question because usually patients, when they sustain an injury, when they're playing sports, they initially attribute this to being maybe a sprain that will just sort itself out. So when should they actually make the step of seeking medical advice? Obviously, any ankle that is still sore and not fully recovered should be examined and assessed properly. So this is the short answer. The more detailed answer is mainly some patterns of pain that we recognize after sports injuries. So the first pattern, for example, is patients complaining of pain over the outer aspect of their ankle. These are patients who have torn ligaments and they're now using the peroneal tendons on the outer aspect of their ankle to compensate for the instability. So if somebody goes over their ankle and after, a good 4 or 5 weeks, they're still experiencing pain on the outside, usually it means that there's some form of ligament damage and they're using these tendons to compensate. So that's maybe the first pattern. The second pattern are patients who have damaged the joint surface. So these patients who have osteochondral lesions, they present with a deep, dull ache within the joint. So they move their ankle okay, the ankle is not unstable, but once they start exercising or running, for example, they get a deep, dull ache in the joint and they cannot pinpoint where the pain is. So again, these patients should be examined. They need to have an MRI scan. They need to be assessed to find these lesions and to treat them appropriately. Also, another pattern are patients who experience abnormal movement in the joint or locking, for example. So you feel like the joint is catching or locking. These are all signs that there could be some cartilage lesions causing problems. Weakness. If there is any form of weakness, patients cannot stand on tiptoes, cannot push up as much as they should. These could be indications that they have damaged the Achilles tendon, for example. So any ankle that goes through a trivial sprain should be much, much better within weeks, within a couple of weeks or more. And at all times, the patient shouldn't need to strap their ankles to actually carry on playing or exercising, because a lot of patients do that. They just feel like, okay, we're strapping the ankle and it's now fine. You shouldn't really have to strap your ankle. If you have to strap your ankle to actually play, it means that the ankle is possibly a bit unstable. Because cumulatively, if you leave an ankle unstable, it will go into arthritis. So these problems, even if they are manageable for a period of time, they really need to be assessed properly to prevent long-term problems. So obviously the treatment will depend on the problem. So I'll maybe speak about the two very common scenarios that we see. So the first scenario is the ankle instability. So this is somebody who went over their ankle, but the ankle is now still sore, mainly over the outer aspect of the joint. They don't trust their ankle that much. They have to strap their ankle to play. They find that the ankle can give way on them if they do simple activities. And this is the ankle instability. Here, the initial treatment should be physiotherapy to strengthen the ankle muscles and improve the proprioception. If after a good course of physio, the ankle is still symptomatic, then this patient needs surgery. And this is particularly important in young, active athletes because they need to recover quite quickly, and they also need to avoid cumulative damage in the joint that can result into arthritis in the future. And ankle ligament surgery is very rewarding surgery. It's surgery that restores stability to the ankle, prevents cumulative damage, and instantly the patient feels a very good relief of the pain. So there are different ways of doing ligament repair around the ankle, including now keyhole surgery to do the repairs, and the results of these operations are very, very good. The second category that we see that are very common are osteochondral lesions or focal cartilage damage. As I mentioned before, these present usually as a deep dull ache within the joint that happens when the patient starts to exercise. There is no much conservative treatment that can be done to those, and the treatment here depends on the size of the lesion, the location of the lesion, the stability of the lesion, the age of the patient, the medical comorbidities. So they need good assessment by the surgeon. And the treatment is usually either keyhole surgery to perform some drilling of the lesion to initiate healing to happen, or if the lesion is big enough, then they need reconstruction. And there are various ways of doing reconstructions. We use a technique that involves bone grafting these lesions and covering them with a collagen membrane, and it restores the joint surface extremely well. And the results are very good, particularly in young, healthy patients who are very keen on sports.